Hi there, I'm Sumit Sharma, and today we are going to discuss a topic, very relevant topic in the ENT that you can come across very oftenly while in the OPDs or in the periphery as well. So, how would you diagnose or how would you differentiate that whether it is CSF that is leaking from the nose in a patient or it is the typical nasal secretions because of some rhinitis or some other condition? So how will you make a differential diagnosis? This is I'm going to discuss, starting with the history the patient gives you. History in case of a patient of CSF rhinorrhea, that is the CSF looking from the nose, would say that I was operated previously with some sinus for some sinus surgery, for some nasal surgery, or for some tumor in the brain that caused increased intracranial pressure. So the typical history would be like this. But if you look on the other side, that is the typical nasal secretions, the patient would give the history of sneezing, of nasal stuffiness. He would say that there was itching in the nose or there was increased lacrimation, like this is a vague complaints, and the patient gives you in case of nasal secretions. But in CSF fluid it is very clear he was operated for some surgery. Then the flow of discharge. The flow of discharge, this is the golden point that I want you to remember. In case of the CSF leaking from the nose, that is CSF rhinorrhea, the patient would say when he leans forward or when he bends forward, then there is some few drops of nasal secretions leak, and then there's a gush of fluid that leaks out of the nose, and he cannot sniff it back. That is, with all his conscious effort, he's not able to sniff it back, he's not able to control it, I mean to say. But in case of nasal secretions, you are very well versed, because everyone suffers with common cold. It's a very common condition. Everyone suffers from common condition, and you know that in the nasal secretions that can be sniffed back. That means you can control. You can voluntarily control the secretions, but while bending forwards, it does not come out. So and of course it is continuous. It is continuous, no effect of bending forward, or there is no effect. But here there is the effect in CSF rhinorrhea. Third is that the character of discharge. If you talk of the character of discharge, then it is, in case of CSF rhinorrhea, it is thin, watery and clear. Thin, watery and clear, because CSF is thin, watery and clear. But if you talk of the nasal secretions, then it could be slimy like mucus, or it could be clear like tears. Both could be there. Possibility of both of these could be there. So if you talk of character of discharge that I have talked about, now if you talk of taste, it is sweet in taste. Of course you're not going to taste it, but this is a differentiating point that you must remember. If a patient by chance tastes that, I mean, you just need to know this, that it is sweet in taste. But there is a scientific basis for this, why it is sweet in taste, because the glucose content is more as in the CSF as compared to this nasal secretions. The nasal secretions, they would be salty in taste. Then sugar content, as I mentioned, it is sweet in taste. Why? Because the sugar content is more than 30 milligrams per deciliter, whereas in case of nasal secretion it is less than 10 milligrams per deciliter. Then presence of beta 2 transferrin, this is also a very important point. Always present. It is always present. In fact, it is specific for CSF, that is presence of beta 2 transferrin, that is specific for CSF, whereas in case of nasal secretions it is always absent if you do the laboratory diagnosis of the fluid. So these were some differentiating points that I want you to remember, and so you can help, that will help you basically to classify patients whether it is a case of CSF rhinorrhea, or whether it is simply a nasal secretion. Thanks for watching this video.